I think one way that OTs could read that is to be like, well, that just confirms that there's not evidence for what we do. I think I've started to think of that as kind of like a myth that we tell ourselves, that there's not evidence behind our OT interventions. Do you agree with that? Do you think we should accept low levels of evidence? Where do you stand on that?
Yeah, so I totally 100,000,000% think that it's a myth when folks talk about how OT doesn't have any evidence for what we do. I think that is very absolutely incorrect. And I think sometimes it's really hard for folks when they spend a lot of money and time learning about an intervention and utilizing intervention that, I mean, it's tricky. And then to hear that maybe that intervention or that treatment strategy isn't super evidence-based within OT, we are a really incredibly evidence-based, research-informed profession. It's super research-informed, and we have many treatment strategies that we can use to support sensory processing differences from like a neurodiversity affirming standpoint. Like we can focus on mental health promotion, we can focus on environmental modifications. There's the CERTS model. We can use activity-based cognitive behavioral strategies and really working on amplifying the autonomy and the voice of the individual. And there's so many things that we can do. And yeah, it is kind of frustrating when folks talk about how OT isn't evidence-based, because we really are. And I think that is also speaks to how we do have we have so many research articles, we have so many interventions that sometimes we get stuck kind of like we're like in an ocean of a lot of these articles and these interventions. And sometimes it's hard to kind of really, in a meaningful and efficient practice, like trying to absorb it all and try to figure out what to use, which is also why I love your podcast and what you're doing with OT Potential, because you're essentially trying to take a lot of what these articles are saying and providing it in a digestible format. Because even with your podcast, you're illustrating how we do have a lot of evidence for what we're doing. I just think sometimes it's hard for folks to hear that maybe something that they really believe in isn't super evidence-based. And this is something that I've been tackling with myself, and I've been learning myself too. And I think there's a lot of confirmation bias in there, where we have a tendency to look for and interpret information in a way that supports our beliefs and what we want from an intervention. But no, we have OT is very evidence-based, 110%.